Hey guys, and welcome to another episode of Heart and Lung. Today we're going to talk about this, an observation chart that provides an early warning score, abbreviated as EWS or UWS. I've so far seen two variations. They are the NEWS, which is the National Early Warning Score, and MUSE, which is the Modified Early Warning Score, which is actually slightly adjusted to suit that specific clinical setting. This was created as a tool to indicate the physiological state of all patients in an acute setting. Timely observations are crucial to identifying those patients who are at risk of deterioration. It takes into account the 6 cardinal vital signs: respiratory rate, blood pressure, temperature, oxygen saturation, heart rate, and the AFPU response. Each of these signs are given a score according to the patient's physiological state. This is then totaled to provide an overall score, or the early warning score. The final score will decide whether or not the frequency of monitoring needs changing, or whether escalation is required. The first of the vital signs to be recorded is the respiratory rate, or breaths per minute. Some professionals count the breath for the whole minute, and some professionals count for half the minute times 2. Normal respiratory rate differs from person to person. However, generally, normal respiratory rate should be between 12 and 20 breaths per minute. If they have a decreased respiratory rate, you may wish to check to see if they have any heart conditions or increased blood pressure, or whether or not they're on any medication that causes the decrease as a side effect. Even something as simple as the room temperature can cause a decrease in the rate of respiration. If their respiratory rate is increased, you may wish to check their blood pH. A pH of less than 7.35 suggests that the blood has a greater concentration of carbon dioxide, which in turn means that the more active tissues in the body require more oxygen. By breathing quicker, the body wants to get in as much oxygen as possible to meet its demands. Once the demands are met, the breathing rate should return back to normal. The increase in breathing may be caused by exercise. Maybe the patient was being mobilized to the toilet prior to having his OBS taken. Fear or anxiety. An even position. Maybe the patient slumped in bed, decreasing his ability to actually take in as much oxygen as possible. The next vital sign is oxygen saturation. For healthy patients, a saturation of greater than 96% is considered normal. For those with chronic obstructive pulmonary disease or COPD, however, a saturation of between 88 to 92% is considered normal. Decreased oxygen levels is called hypoxemia. You may see the patient compensate for this by increasing their respiratory rate. This is measured in hospitals by using a small device that can either be clipped to your finger, ear, or your toe. Causes for decreased oxygen levels in the hospital include low hemoglobin levels, asthma, COPD, chest infection, sputum buildup, heart conditions, and even more severe conditions such as a pulmonary embolus or even a heart attack. To help maintain oxygen levels, the patient may require supplement oxygen, which they will eventually be weaned off of. They may also require physiotherapy if the cause for decreased oxygen levels is a build-up sputum, for example. The next vital sign is temperature. This is assessed using an electric thermometer and placing it into the ear. The normal levels for temperature are between 36.1 to 38 degrees centigrade. That's between 96.9 and 100.4 for those special people who don't know. A rise in body temperature or pyrexia may indicate an infection. Very high temperature can affect the way the hormones in your body communicate with each other, which can lead to convulsions or in even severe cases, death. A decrease in body temperature could indicate hypothermia. At this stage, the body loses more heat than it generates. Those that are older are at greater risk, especially if they're not very active or if they're on medication that affects the way the body regulates temperature. This is quite rarely seen in the hospitals as patients are monitored quite frequently. The next vital sign is blood pressure. There are two numbers when taking blood pressure. The top is the systolic blood pressure and the bottom is the diastolic blood pressure. The systolic number illustrates the pressure at its highest when the heart beats and pushes blood around the body. And the diastolic number illustrates the pressure at its lowest when the heart relaxes between the beats. Healthy blood pressure is between 90 systolic and 60 diastolic, and 120 systolic and 80 diastolic. A decrease in blood pressure is known as hypotension. Those that have low blood pressure may present with dizziness, fatigue, nausea, or even blurred vision. In extreme cases, it can cause shock, which is when the blood is not circulating around the body to the vital organs. Postural hypotension is a condition that all therapists are aware of. It's when the change in body position causes a drop in systolic blood pressure of 20 mmHg. Some professionals tend to rely on symptoms such as lightheadedness or blurry vision. Other reasons why hypertension occurs can be medication type and amount, dehydration, malnutrition, infection, blood loss, or even low blood sugar. An increase in blood pressure is called hypertension. This is a condition where the blood pressure in the arterial walls is persistently high. About a third of the UK have hypertension, and it's generally related to sedentary lifestyles and a poor dietary intake. It's known as a silent killer because it does not present with any symptoms. Patients can appear totally fine upon observation. From a therapist's point of view, there's not much we can do at that time, apart from possibly advising a change in lifestyle, maybe. The penultimate vital sign is heart rate. This can be measured by taking the patient's pulse. Normal heart rate is between 60 to 100 beats per minute. A lower heartbeat may indicate that the heart is more efficient. For example, an athlete may have a resting heartbeat of 40. However, if the patient you're taking obs for is not a well-trained athlete and is presenting with a lower heart rate than normal, it's likely he's become bradycardic. People with bradycardia may present with lightheadedness, fatigue, confusion, and even shortness of breath. In severe cases, it can lead to a cardiac arrest. It may be caused by heart conditions, hypothyroidism, and even medication. An increase in heart rate is known as tachycardia, of which there are 3 types. The first is sinus tachycardia. This is simply when the heart beats faster and regularly. Commonly, this occurs after strenuous exercise, post-mobility for example. However, this may also be caused by medication, emotional distress, and even anxiety. The second and third is supraventricular tachycardia and ventricular tachycardia. This is when abnormal messages are sent across the heart. The abnormal messages prevent the heart from filling fully before it contracts, jeopardizing the blood flow to the rest of the body. Symptoms may include chest pain, dizziness, shortness of breath, and fatigue. The final vital sign is the AVPU scale, the AVPU scale. This is a tool used to measure the patient's level of responsiveness and how conscious they are. A stands for alert. Patient is fully awake, eyes open, responds to voice, and is able to move his limbs. V stands for voice. Patient responds to voice by either making a sound, moving a limb, or opening his eyes. P stands for pain. Patient responds to pain. This can be done by either squeezing the fingers or rubbing the sternum. And U stands for unresponsive. This is when the patient does not respond to any of the above. From a therapy standpoint, unless the patient requires chest physio to remain comfortable, we seldom see patients who respond to pain or who are unresponsive, as they'll probably require medical help prior to therapy intervention. So those are the vital signs that provide an overall early warning score, or EWS. In an acute setting, understanding and interpreting these can help to identify concerns earlier on and can also help to tailor the intervention to the patient's benefit. It's important to understand that this should only be used as assistance to your clinical judgment and should not replace it. Hope you enjoyed it. Please subscribe down below to follow for further quick brief answers to questions you may have. Take care and I'll see you later.